Variations of alternative medicine, light therapy, herbal medicine, applied kinesiology by Mary Banker. Alternative medicine takes on a variety of forms, all of which can be beneficial to someone's health. Light therapy, herbal medicine, and applied kinesiology are all common ways of practicing alternative medicine. These practices show much success with little to no adverse effects. Alternative medicine and therapies have been practiced for centuries, all of which have been developed by physicians and surgeons. These therapies and remedies should be considered prior to the use of synthetic or chemical-based medicine. The first alternative therapy that will be considered is light therapy. Thousands of years ago, health practitioners reported the benefits of the sun for health. Heliotherapy, which is natural light from the sun, was praised by Hippocrates, along with the physicians from Rome and Arabia. In Rome, the sun treated epilepsy, paralysis, asthma, jaundice, bladder, and colon diseases. In 1903, Dr. Neil Fizin won the Nobel Prize in Medicine for his contribution to the treatment of lupus vulgaris with the concentration of light radiation. In recent years, several studies have performed with amazing results. NASA conducted a clinical trial using light therapy with the anticipated goal of reducing painful side effects from radiation and chemotherapy. Cancer patients that were undergoing bone marrow and stem cell transplants were given a far-red, near-infrared, light-emitting diode treatment to treat oral mucositis. Dr. Donna Salzman said, using this technology as a healing agent was phenomenal. The light therapy offered patients several benefits, which include better nutrition, since eating can be difficult with painful mouth sores, less narcotic use, and an increase in patient morale. The patient was administered the light therapy by a nurse holding the device near the outside of the right and left cheek and the neck area for 88 seconds each, daily for 14 days. There was a 96% chance that the improvement in pain was the result of the therapy. Another study used light therapy for the treatment of acne vulgaris. According to the National Institutes of Health, anyone can get acne, but it is most common in teens and young adults. An estimated 80% of people between the ages of 11 and 30 have acne breakouts at some point. Acne hits adolescents at a vulnerable time in their lives. It affects them not only physically, but emotionally. Acne can cause disfigurement and permanent scarring, which may lead to social phobias, withdrawal, and clinical depression. Propionibacterium acnes is a medical term for acne. This bacterium builds a resistance against antibiotics used to treat acne. Typical treatment would consist of benzoyl peroxide, retinoids, topical antibiotics, and glycolic acid. These treatments have side effects, which include dry skin, allergic reactions, and inflammation of the skin. These treatments usually take between 6 and 9 months of treatments. Antibiotic resistance has been documented since 1979. In this clinical trial of blue and red light therapy has been shown to significantly reduce acne. 26 patients with acne were randomly selected. The patients received treatment with a handheld LED light-emitting device. This device is designed to turn off after delivering a dose of 220 joules. For the effective and consistent treatment over a 12.5 centimeter treatment area. The patients had mild to moderate acne for a mean duration of over 5 years. Results from this clinical trial were that lesion counts reduced by 50% in 12 weeks. The maximum clearance in the treatment was 86%. Overall, the patient using the treatment saw an improvement in their lesion count after 12 weeks. When acne is treated with blue and red panels, the active inflammation acne was reduced and helps improve tone and clarity of the skin. This improvement also correlated with the improvement in their social confidence and self-appearance of patients. Light therapy is non-invasive and has a positive side effect of clearer skin. The next alternative medicine being summarized will be herbal medicine. Herbalism dates back approximately 3000 BC. The ancient Greeks and Romans were renowned herbalists. Surgeons traveling the Roman army spread their herbal expertise throughout the Roman Empire, in Spain, Germany, France, and England. Socrates and Galen were both Greek surgeons in the Roman army, compiled herbs that remain the definitive material medical text for 1500 years. Herbalism is still used today. China uses traditional Chinese medicine, which evolved over thousands of years. Traditional Chinese medicine practitioners use herbal medicine to treat and prevent health problems. In the United States, people use traditional Chinese medicine primarily as a complementary health approach. One study regarding herbal medicine describes how herbs help fight cancer. There were an estimated 14.1 million cancer cases around the world in 2012. This number is expected to increase to 24 million by 2034, according to the World Cancer Research International. The majority of cancer patients are often diagnosed after the cancer has reached a terminal stage, at which point chemotherapy is largely relied on. Although chemotherapy may temporarily slow the growth of cancer, it often loses effectiveness as the cancer cells develop a drug resistance. Scutellaria radix is used in traditional Chinese medicine and is a heat-clearing and detoxing herb. Scutellaria radix has been extensively studied as an anti-cancer formula. Traditionally, SR has been used to treat pneumonia, jaundice, hypertension, and dysentery. The most abundant compounds in SR are flavonoids, of which bacillin, wagoncide, and wagonin showed strong anti-cancer activities. Cancer patients often exhibit excessive heat and toxin. Therefore, the heat-clearing detoxing herbs are major components in anti-cancer treatment. This herb, along with several other herbs, are being used in other countries to treat cancer. Herbalism might be a promising approach for the treatment of chronic diseases, including cancers. In another study using Chinese herbal medicine, herbs are being used to treat Alzheimer's disease. Alzheimer's is considered the fourth most frequent common cause of death in the world. Since there are a series of problems with current pharmacotherapy, such as the existence of large contradictions, side effects, high costs, and addictions, the use of complementary and alternative medicines such as Chinese herbal medicine has become relatively common. The herbs used for the treatment of Alzheimer's mainly consisted of Radix rhamnum prepare, ginseng, Fructus ligustri, and fruit of Chinese wolfberry. It has been reported that many people with Alzheimer's have used some form of herbalism to improve their health. More studies are needed to evaluate the actual effectiveness of Chinese herbal medicine for the treatment of Alzheimer's disease. The last alternative medicine that will be discussed is applied kinesiology. Kinesiology is the study of muscle movement. However, when coupled with the word applied, a whole new concept is invoked. Applied kinesiology is the use of muscle testing to evaluate body functions. That is, by manually testing various muscles, areas of dysfunction can be diagnosed. In a recent study about anxiety and sleep disorders, applied kinesiology was used to reduce fatigue, brain fog, and anxiety. One study evaluates a 64-year-old woman that has long-term anxiety disorders, as well as insomnia. Her treatment with applied kinesiology began with the attempt to correct the causes of muscular deficits found throughout the body. Once the dysfunctional muscle was identified, gentle cranial corrections were performed to return strength to the muscles in the neck that tested weak. At the end of her 65-minute session, her fatigue, brain fog, and anxiety were much improved. Over the next 3 weeks, the patient had treatment 6 times, 15 minutes each session, and her anxiety symptoms were resolved. The patient was able to stop taking Ambien, and her self-reported cognitive performance, energy, and physical endurance were much improved. Alternative medicine comes in a variety of forms. All forms are non-invasive and cause virtually no adverse side effects. These methods have been used for centuries, and in recent studies are showing remarkable results. We have relied heavily on our physicians to know what ails us and which prescriptions or chemicals will fix us. Alternative medicine have been around for centuries, and with modern advancement, it just might be what the good doctor ordered. These are my references, which you can look up the complete studies.